Hello, my name is Dr. Ryan Browning. I'm a chiropractor here in Kyle, Texas. And today I'm just going to give you an up-close look at an x-ray. Something I've seen a lot of times, but several times recently. So this is a neck x-ray of a patient that was in an accident and had some whiplash injuries, neck pain, shoulders, all of that. And so here I'm going to show you, this is from the side view. So this is like you're seeing the neck from the side facing that way. And you see the bones coming up here to the top. And from the first look, it's like really straight. And so that might sound like a good thing, but actually when you're looking at the neck from the side, there should be this nice curve in there. Almost like an arcing curve, kind of like a banana. So it should be really shaped into there. And this neck is straight. So what that means, if left alone and just leaving it like this person would be very likely to have chronic neck pain down the road, headaches, and there's some other ramifications too. So if you can imagine, be in the back part of the neck, you can't see it on x-rays, but that's where the soft tissues, all the connective tissue, that's the muscles, tendons, ligaments, all of that. So now, when that neck has gone from being nice and curved to straight, everything behind it is now being pulled further and has that extra tension into it. So reaching back over the shoulder behind you, there'd be like that tension, that feeling of just where it hurts, it's achy, it's sore. Can't really relax because this neck is now straightened out and it has extra tension to it. So something we've seen many times, especially after car accidents. And we want to make sure it doesn't stay like that. So I just wanted to give you kind of an up-close look at that and let you see what it looks like. And then just a few tips also. I mean, none of us ever plan to get in a car accident. We hope it never happens, and I hope it never happens to anyone watching this video. But if it does, just a few tidbits that I would say, just from having treated so many patients afterwards. First and foremost is if there's any chance of significant injury, trauma related, broken bones, there's severe pain at the time of the accident, receive the first responder help. Let them help you. If they need to transport you to the ER, just do it. Or if you need to drive there yourself, don't be afraid. A lot of times people are afraid because they're worried about the cost, rightfully so. But if there's pretty significant issues and you can tell you need some help, just get it right then. It's always better to be safe than sorry when it comes to your body and your health. That would be number one. Number two is going to be the home care. Home care is going to be ice. Ice is good for inflammation, rest, extra sleep, good nutrition. Help your body have what it needs to heal. Do not use the heat, like the heat pack. When soft tissue, ligaments, muscles, tendons, all that's trying to heal, you want to push away the inflammation. Ice is going to help you. Heat is going to make it worse. The next step, once you know you're cleared from like trauma care, from the ER, from no broken bones or damaged organs, things like that, that's when you need to, as soon as you can, find the chiropractor that can treat whiplash and auto injuries and has experience with it. You want to make sure you receive a full chiropractic examination. X-ray should be part of that to make sure, just to double check, and then a treatment plan put into place. The three goals of that treatment in my office, first and foremost, is going to be pain and symptoms. Let's get things, get those out of there, get those doing better. Should feel better. That's why you're initially calling. That's goal number one, is pain and symptoms. Goal number two is going to be, I call it, pre-accident status, getting you back to how you were before this accident happened. Your activity level, your ability to work, to do chores, just to overall enjoy life. That should return, and sometimes it takes a while. You may be fatigued, you may not feel like doing very much for a while. That's normal after an accident. Let your body have time to get through this. It's going to be healing a lot of areas in your body, some you're probably not even aware of. That's going to use up your energy. That's going to take a lot, and you just may not feel like doing a whole lot for a while. don't feel bad about it. You know, give yourself that time. So that's number 2. Goal number 3 is going to be resolving the accident injuries and not allowing it to cause future problems. That's a big issue. A lot of times people, you know, the pain kind of goes away quick, so they just figure it's fine. A year and a half down the road, they show up with all these issues, not sure why. It's because they never were really fixed in the first place. So make sure you go through that full process to know that you're not going to have these issues pop up later down the road and be harder to deal with then. So that's just a few tips. Have many more. If you have any questions or comments, you can always feel free to contact us at the office, or of course on this video as well. And I hope none of you ever need this information, but chances are, if not you, someone in your family, a friend, is going to be in an accident, and you can at least be resourceful in knowing, you know, what to do. Or if you are in our immediate, you know, Kyle, Buda, San Marcos area, let us know. Happy to help direct you in any way. Thank you.